What all these Republicans have made us know or made us aware, or that we should be aware of, is this very simple thing. Alan Grayson was absolutely correct when it came to his description of the GOP health care plan, and his statements ring true to this day. Anybody need a reminder of what Congressman Grayson said? Here we go.
Thank you, Madam Chairman. You may recall that a few weeks ago, President Obama came to this chamber and he addressed the chamber on health care before a joint session of the House and the Senate. During that session, I was privileged to be here, and I saw my colleagues on the far side of the aisle, the Republicans, waving pieces of paper during his speech. And I was wondering what they were. I couldn't imagine. It almost seemed like they wanted President Obama's autograph. I just didn't get it. I heard from one of my colleagues that this is what they called the Republican health care plan. I went over after the speech was over. I picked up a copy that was lying down on the Republican side, and it turns out that the Republicans' health care plan was a blank piece of paper. I inquired further, trying to find out exactly what the Republicans' health care plan is, and it's my duty and pride tonight to be able to announce exactly what the Republicans plan to do for health care in America. It's this. Very simply, it's a very simple plan. Here it is, the Republicans' health care plan for America. Don't get sick. That's right, don't get sick. If you have insurance, don't get sick. If you don't have insurance, don't get sick. If you're sick, don't get sick. Just don't get sick. That's what the Republicans have in mind for you, America. That's the Republicans' health care plan. But I think that the Republicans understand that that plan isn't always going to work. It's not a foolproof plan. So the Republicans have a backup plan in case you do get sick. If you get sick in America, this is what the Republicans want you to do. If you get sick, America, the Republican health care plan is this. Die quickly. That's right. The Republicans want you to die quickly if you get sick. Now, the Democrats have a different plan. The Democrats say that if you have health insurance, we're going to make it better. If you don't have health insurance, we're going to provide it to you. If you can't afford health insurance, then we'll help you to afford health insurance. So America gets to decide. Do you want the Democratic plan or do you want the Republican plan? Remember, the Republican plan, don't get sick. And if you do get sick, die quickly. Thank you very much, Madam Speaker.
We need more Alan Graysons in the House, at least when it comes to that sort of thing, because holy crap, is how his comments still ring true to this day. It proves that, you know, these Republicans have not changed a bit their callous nature when it comes to poor people, when it comes to the sick, when it comes to folks who, you know, need help. They just don't want to give it to them. And if you actually looked at the Republican health care plan that they're actually trying to push, and if you remember during the whole debate over the Affordable Care Act, they were waving some papers, whatever, and some of them might have been empty pieces of paper, but some of them contained their version of the bill. And their idea of compromise was do what we want to do instead, because they don't understand what compromise means, because Donald Trump says that he loved the poorly educated, and they keep trying to prove their love. They were trying to prove themselves to be poorly educated even well before Donald Trump was even in the picture, apparently. But they were preparing themselves to be able to have a long list of examples of why they are poorly educated, so they could show Donald Trump sometime in the future. Maybe they could tell the future. Maybe they could, divine certain things. Why they didn't learn the Powerball numbers and let us all know, who knows? But yeah. And their plan was basically that you should be able to sell insurance across state lines. What does that mean? What that means is that individual states shouldn't be able to regulate insurance, like the 10th Amendment would say that they should be able to do. And instead, they would say you sell it across state lines, which would then allow companies to go to the state that has the fewest regulations and sell from there, so that the people in other states with bigger regulations wouldn't be able to have a say in what was going on, and so people would get horrible health insurance. And then if you didn't qualify for health insurance because, you had a pre-existing condition, they would shove you into high-risk pools, which basically means that these high-risk state-run pools would have to insure these high-risk folks without the ability of getting to benefit from the low-risk folks. That's not how insurance is supposed to work. If you have a work insurance, you have an enrollment period during your, open enrollment session, or you might have a special enrollment period if a qualifying event happens. But you aren't denied based on your existing health, because the idea is that you have a large enough pool of people that if you happen to have some people who are having high costs associated with it, that will be offset by the people that don't have high costs. It'll all average out in the end. That's how insurance is supposed to work, but the Republicans don't understand that, because the Republicans are full of those poorly educated people that Donald Trump claims to continue to love.